Blue Springs, Alabama. Population 110, counting chickens. That's over in Barber County, about 30 miles from Eufaula, 40 miles north of Dothan. My father was a GP there for 42 years. He graduated from Medical College of Alabama. It was in Mobile at that time in 1910. I have two brothers who are GPs, and one who's a dentist and one who was a veterinarian, and one who was a civilian. I went on calls with him sometimes. We'd be going all night long out on labor cases, maternity cases, and they called them labor cases in those days. And we'd stop at some country store and buy some sardines and crackers, and I thought that was wonderful. Well, I graduated from the University of Alabama. I'd already been in the Army and the Airborne, and I was commissioned as second lieutenant in the infantry, and went to Mobile and tried to get into an infantry unit, and I told them I was an intern, so they said, no, you're going medical. We got a medical unit, hadn't had a doctor in it in 7 years. So I became medical in the National Guard and continued to go to my summer camps. It was difficult. I was a solo practitioner during those years. Continued to go in to do the military medical education that was necessary, and ended up being the Deputy Adjutant General for the Alabama. I don't think in those big terms much, but the one is getting the care to the people. You know, as we all know, there are many counties in Alabama that have inadequate medical help. And I think educating and getting people to provide that is the big problem. I'm old enough to remember when UAB moved from Tuscaloosa to Birmingham. One of my brothers was in the first class to graduate in Birmingham. And it was formed by then Governor Sparks and the legislature to provide primary care doctors for Alabama. But it was my alma mater. I finished there in 1956, and it has failed in its purpose. It's not doing that at all. I don't think he has a department of family practice. So then, during Governor Wallace's administration, it was decided we would find a new school in Mobile to provide primary care for Alabama citizens. We have again failed in this effort. It seems that the accent is not on family practice at either of the medical schools. So that's why I got involved in the program that we're dealing with now to try to correct that problem. In the Bible, it says, let us go to Dothan. So we went to Dothan. I'm delighted. I think it's well planned and it's been well executed. And the people in Dothan have been tremendously receptive, as I had never doubted that they would be. It's always been a forward-looking town. And it's in an area that includes large parts of North Florida and southwestern Georgia. So it's an ideal location. I find that the level of competence is no different. They're completely, they're as well trained as we are, better because they know something we don't know. And I've never had a patient ask me if I was an MD or a DO, and they just want to know what I can do about their problem. To use one of Governor Wallace's old terms, there's not a dime's worth of difference.